Hello everyone, this is Ivan Belostenko for IBAN TV, Go Against the Tide. And with us today we have a very special guest, Dr. Anthony Levatino, who was one of the main doctors starring in the movie Unplanned. Hello, doctor. Can you hear us okay?
Hello, Ivan. I can hear you fine.
Great. Thank you very much for taking time to join us today. Really looking forward for this interview. We've seen and also broadcast on our TV some of the appearances you had both on the set of Unplanned, and we mentioned the congressional hearing and some of the other things and comments that you've done. So let's jump right in it. I'm sure you have you're pretty busy man. So let me go ahead and start with the first question. Can you describe to us briefly some of these abortion procedures? How do they look like? Because I noticed that people know about abortions, but they don't actually always know what it entails, what it involves. So can you describe us how it looks like?
I understand. The type of abortion procedure that is performed depends on how far along a pregnancy that woman is. If she's in the first trimester, and we measure that from the time of her last period until she's 12 to 13 weeks after her last menstrual period, there are two types of abortions mainly that can be done. One are medication abortions, where she takes a series of medications. The other is a suction D&C abortion. The oldest one is the suction D&C. And even though medication abortions are becoming more frequent, the majority of first trimester abortions in most places are still done by suction D&C. And a suction catheter is used, and actually I can show it to you. I'm sitting in the right place. A suction catheter is used and introduced into the, where am I going here? Introduced into the uterus, and a suction machine is turned on, and the baby is pulled to pieces. This is the same abortion that was shown in the movie Unplanned at the beginning of the movie. A medication abortion is done by taking a series of medications. Mifeprex or RU-486 can be taken, and then it's followed by a second drug within 24 to 48 hours later, and it induces a miscarriage. In the second trimester, when babies are bigger, when I said up to 13 weeks, if your guests look at their hand, the width of their hand from head to rump is the size of a 12-week baby. Baby's formed, his 2 arms, 2 legs, beating heart, but that's how big babies are at 12 weeks. When they're bigger than this, up to 24 weeks, we do another procedure. Usually we do a procedure called suction D&E. A suction D&E abortion is different. You can't just use the suction catheter like you can for a suction D&C because the babies are too big. For example, at 20 weeks from her last menstrual period, her baby would be from head to rump, from the tip of your middle finger to your wrist. So we're talking about a baby almost this big. Well, babies that size, they don't fit through catheters this size. So for that abortion, you need something stronger. And we use a device called a Sofer clamp. This is one. And you use this device to literally pull the baby apart. I tell people, imagine that you're the doctor and your patient is 20 weeks pregnant and you're going to do a D&D abortion. It starts off with a suction, just like the earlier abortions, but all it removes is the fluid. To actually get the baby removed, you have to use this instrument and tear off the arms, the legs, tear out the chest, tear out the intestine, the heart and lungs, and then you have to, and you do this in pieces until you get to the head of the baby. The head of a baby that size is about the size of a plum. Be pretty sure you've got it if your instrument's around something and your fingers are spread as far as they can go. You'll know you did it right if you crush down on the clamp and then white material comes out of the cervix. That was the baby's brains. And then you can pull out skull pieces. Sometimes a little face stares back at you. Even later than that, D&D abortions, the one I just described, can be done up to about 24 weeks. After 24 weeks, and 24 weeks is a big baby. I mean, if 20 is the length of your hand, 24 is another maybe 3 or 4 centimeters. After that, there are various abortions that are done, and basically injections are given to the baby while the baby is still in the uterus to kill the baby, to stop the heart. And then labor is induced, and these women will deliver their dead son or daughter. I've been showing a video where this is perfectly legal in the United States for any reason. I've been showing a video from a clinic in Albuquerque, New Mexico, a state where I used to live. I now live in Arizona, where these abortions are done regularly. And a woman in the video is 27 weeks pregnant, only 13 weeks from her due date. And she's laboring in a hotel room. She's delivering her dead son or daughter into a toilet. And this is perfectly legal in the United States. You know, it doesn't matter what type of abortion is being used. Ultimately, they're always the same. You're either taking a medication or paying the money to a doctor to tear your baby apart. And in the end, whatever method you use, you're deliberately killing your own son or daughter.
So, thank you very much for describing this. It all sounds like a pretty inhumane procedure and even monstrous. What do you think is the reason that we still have those procedures? Why are they not outlawed completely?
The world has changed a lot in the last. I'm 67 years old, and the world has changed a lot since I was, when I was a young person. Birth control came along, and it was a huge change to our society. I'm not saying it's a bad thing, but because it's changed our view of life. Women and men and women can get together, and they can avoid a pregnancy in the vast majority of situations. And generally, this can be a very good thing if you are contracepting, if you're preventing a pregnancy. The problem is contraceptives don't always work. Or even more often, or I won't say more often, they either don't work or they don't even get used. So pregnancies result. No contraceptive is perfect. And then the question becomes, now what is she going to do once she becomes pregnant? And people who are in favor of abortion will tell you that we need abortion because contraceptives aren't perfect. She can still get pregnant, and then abortion somehow becomes the last option that you use to prevent her from having a child. You might even call it the final solution. To me, I have absolutely no problem with couples avoiding pregnancies by using contraceptives. But when you use them, you have to understand what type of contraceptive is being used, how effective it is, and the fact that there is a risk that you're going to become pregnant. Once you become pregnant, you're a mother, you're a father. Abortion doesn't make you not be a mother anymore. You're just either the mother of a live child or the mother of a dead child. And that's where I and many obstetrician gynecologists have a serious problem. I'm perfectly happy to help people avoid pregnancies. I'm not willing at this point, even though I did abortions in the past, I'm not willing to do abortions and kill innocent children. It's interesting, despite so the real answer to your question is, why do we have abortion? Because people want it. It's interesting, a lot of people don't realize, though, the vast majority of obstetrician gynecologists in the United States will not do abortions. There was 2 studies that came out, one about 10 years ago, said that 86% of obstetrician gynecologists in the United States will not perform an abortion. Another one came out just 2 years ago and looked at doctors like myself in private practice. And 93% of obstetrician gynecologists in private practice will not do an abortion. This kind of becomes important because you're going to hear a lot about how abortion is healthcare. I'm not quite sure exactly what that means because there's no other type of healthcare that I'm aware of that results in a dead human being. But if abortion is so important, if abortion is such vital healthcare, then why do 93% of the practicing obstetrician gynecologists in the United States refuse to do them?
Yeah, that's a good point. And one more question as well is, You mentioned somewhere about all throughout your practice, you very rarely had to resort to an abortion in order to save a woman's life. We always hear that argument thrown a lot that, sometimes abortion is justified because mother is in danger. So from your experience, what amount of abortions you had that you actually had to do that to save a woman's life? That was the reason.
That's an important question, because the pro-abortion side wants to keep up bringing so-called hard cases. What if the woman's raped? What if it's a case of incest? What if her life is in danger? These are important questions, but they are not the vast, vast majority of abortions. All right, so pregnancy can be dangerous. There are various medical conditions that can occur in pregnancy that are very serious for the mother and may even kill the mother. And there comes a time when in the treatment of pregnancy, we have to end a pregnancy in order to save a woman's life. Now, I worked in what's called a tertiary referral center for 10 years, where I was doing a lot of high-risk obstetrics. And that hospital got referrals from all the surrounding areas of women who were seriously ill from their pregnancies. I've seen cancers, I've seen serious heart disease, I've seen out-of-control diabetes. I've seen what's called preeclampsia pregnancy, where the blood pressure is very, very high and there's a significant risk of injury or death to the mother. And I have treated, but the key to these things, yes, pregnancy can be dangerous, but the vast, 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 vast majority of the time, these conditions occur after her child is viable. Now, term, when babies are full term, is at 40 weeks. But medical science has gotten better and better over the years at taking care of premature babies, to the point now where even the World Health Organization acknowledges that the point of fetal viability is at 22 weeks. The vast majority of the time, these serious complications of pregnancy occur after the baby's viable. So people will, what would you do if a woman has a condition where pregnancy is going to kill her? I do a delivery. I delivered, in over 10 years, I treated hundreds of women with these conditions. And I have ended, as a pro-life obstetrician, I have ended hundreds of pregnancies to save a woman's life. But the number of babies that I had to deliberately kill in the process was zero, was none. Now, did all those babies make it? No. Some of them were so premature they simply couldn't survive. But most of them did. There's confusion. People will say that ending a pregnancy is same a woman's life as an abortion. No, it's not. It's called a delivery. If there are conditions, and there are common conditions even in early pregnancy that keep coming up, and people confuse them with abortion. Ectopic pregnancy, where the pregnancy is in the tube, is extremely dangerous to the woman's life. There isn't a pro-life obstetrician gynecologist that wouldn't take care of her and remove that pregnancy. That's not the same thing as an elective abortion. So there's some confusion on these terms.
One more question about that. So if you can describe the typical profile of a woman who comes for an abortion, what would she look like? Age and reasons?
Many women who come in for abortions are all ages. Many of them are younger, but not all of them. In my country, almost 1/3 of women in this country have had at least one abortion. So you see the numbers are very, very high. Often young, but not always. They come from all economic classes. They come from people who are not so advantaged economically and people who are very, very well off economically. They come from all social classes. They come from all religions. I don't think there's such a thing as a typical abortion patient.
How do you deal with, with the consciousness of the fact that you yourself took part in these procedures, but also how would you recommend people who either mothers or as well fathers who are part in the decision making, about abortions, where to seek, reconciliation with the guilt and the pain after the abortion has been done? What would be your advice to those people, both to doctors and to patients?
It's very interesting to bring up that question because according to the American College of Obstetrician Gynecologists, according to the American Psychiatric Association, according to the United Nations, there is no such thing as mental trauma following an abortion, that this is a fiction. Well, that is ridiculous. Women who've had it, not every woman who has had an abortion is going to regret it later on, but many do. I saw them all the time in my practice. In the United States, we have what are called crisis pregnancy centers or pregnancy assistance centers. These are volunteer organizations that come together to help women who are in pregnancies that are unplanned. They offer pregnancy testing. They offer testing for sexually transmitted diseases. They will help them get medical insurance and medical care for their pregnancies. They provide ultrasound services. They provide supplies like baby supplies and diapers and strollers and many other things that women need. And in this way, we give women support who are in a pregnancy that wasn't planned so that she can really make a choice. We always talk about abortion as choice. By giving women support, you'll often find she'll often realize she doesn't need to choose abortion, that she can take her baby to term. Now, part of those centers as well is counseling for women who've been through abortions who regret it. And sometimes that regret or that shame, as you mentioned, it doesn't come until years later. And she's going to need caring and support when that time comes, and the crisis pregnancy centers provide it. Women may find support through their church. They may find support amongst their friends. There are many places where people go to solace. I mean, you talked about doctors. I did 1,200 abortions. How do you take that back? I can't make up for the death of 1,200 children. But I do what I do. As I tell people, I can't make abortion illegal in the United States, but I do my best to make it unthinkable.
What was personally the reason for you to get involved and not just stop in doing it, but you're actively vocal and you took part in this amazing film? Is there a personal reason why you done that? Can you tell us about also what happened with your daughter as well?
Well, when I was young, if you asked me how I felt about the abortion issue, I would have told you I was pro-choice. I wouldn't have hesitated for a second. This was a choice between a woman, her doctor, and no one, including the baby's father, had any say about it. When you're a gynecologist and say you're pro-choice, then it's up to you to actually do the abortions. So when I was training to be an obstetrician gynecologist, I learned to do first and second trimester abortions, right along with learning how to do deliveries and hysterectomies and all the things obstetricians do. I was very dedicated to it. I met and married my wife. She didn't believe in abortion. She was pro-life. And we didn't talk about it for many years, and that was a very big mistake. We wanted to have children of our own. We couldn't, and we were very fortunate to be able to adopt a little girl right out of the hospital that we named Heather in August of 1978. In 1984, when she was just 2 months short of her 6th birthday, she was killed in an auto accident. Any parent may think they have some idea of what it would be like to lose their child. If you haven't been through this yourself, you have no idea. After losing my own child, I went back to my job, including doing abortions, and I really struggled with it for many months because the doctor knows that he's killing a baby. He knows that he's killing somebody's perfectly healthy son or daughter in the vast majority of cases. And I really struggled with it after that. You know, when I talked earlier about doing a second trimester D&E abortion, and I talked about taking out arms and legs and other body pieces, you must, when you do an abortion, you have to keep inventory. You have to make sure that you get 2 arms, 2 legs, and all the pieces. Because if you don't, your patient's going to come back infected, bleeding, or dead. So I finished that second trimester D&E abortion after my daughter died. And I seriously looked. I mean, I really looked at that pile of body parts. And I didn't see her wonderful right to choose, and I didn't see what a great doctor I was helping her. Didn't even see all the money I just made. All I could see was somebody's son or daughter. And over the next several months, I struggled with it until I finally gave up doing abortion. There's no way I'd do another one. As I said earlier, you can make the language as pretty as you want, but in the end, abortion is paying a doctor money to kill your son or daughter.
Would you say it was an act of God to reach personally to you, and is God using you as a tool now to prevent these procedures from happening?
Well, do what I think is. As far as God is concerned, you better ask him on that one. We got a lot of support from people. I mean, when I got involved, when I stopped doing abortions after my daughter died, the doctors I was working with who still did abortions, they understood. But when I stopped doing abortions, that was okay. But when my wife and I got involved in the pro-life movement, that was not okay. And we lost every friend we had. Let's just say that God put a lot of really caring, wonderful people in front of us. And yes, our faith has been a big part in our healing. But any more than that, you'll have to ask him.
And which brings me to the last question. How do your peers and other abortionists and, like you mentioned, friends react to your change of hearts and change of stance?
Well, it's really interesting. As I said, when I stopped doing when I stopped doing abortions, that was okay. But when I got involved in the pro-life movement, that we literally lost every friend we had, which is to say we didn't have such very good friends. But as I said, God filled in the void with pro-life friends, and even to this day, I mean, what I do is not a secret. I have friends who disagree with me about abortion. I think abortion's a good idea. But if they're real friends, we stay friends despite that. Those are the kind of friends you want. The rest of them, they can live their lives, and I'm not going to worry about it.
Finally, any last thoughts to people who are considering abortions, both males and women and men? What would you say to them, and also to doctors who are still taking part in these procedures?
Excuse me. It's really important to understand one thing. When a woman is pregnant who doesn't intend to be pregnant, she is under tremendous stress. She is worried about many things. She's worried about her future. She may be worried about her job. She may be worried about school. She may be worried about money. She may be worried about relationships. She may be worried that she doesn't want her dad to know that she's been having sex with her boyfriend. There are many, many things that may be driving a woman and making her feel like an abortion is a good idea. But no matter what her economic circumstances, no matter what her school and education circumstances, no matter what her job circumstances, it's important for her to understand that there's one thing that she can give her son or daughter that no one else can give, and that is a chance to live and to enjoy life just like they do. That's the most important thing I can say. You hear all the time about it's the fetus or it's an embryo, and those are scientifically correct terms, but when most people are using those terms, they're really dehumanizing that individual human being. So I don't use, I will sometimes use the term baby as I have today. I almost never use the term embryo or fetus. I always talk about abortion and what we are talking about today using the one term that is always correct. This is your son or daughter. If you think about it in those terms, sometimes it makes it very clear what you're actually trying to decide.
Dr. Levatino, thank you very much for taking time to speak with us. It was an amazing interview, and please continue doing the work that you do and reach out to people who are facing this hard choices, and we hopefully see you again perhaps in our future shows, and we wish success as well for the film as well. It's doing great here in Poland, and we hope it will continue. We're definitely going to put every effort we can into spreading this. So thank you again for joining us, and until next time, this is Ivan Belastenko for Go Against Die TV.
Thank you.
Thank you. God bless.